As the years pass, aging leaves its mark. Our hair begins to thin, our skin loses elasticity, and our bodies become less reliable. The older we get, the more we feel these effects. But what if your own cells were the key to looking younger and living healthier? The future of anti-aging is powered by you. Emerging regenerative cell treatments have the ability to leverage our own cells to heal our bodies. Studies show that cell treatments can rejuvenate and replenish nearly any tissue, from skin and hair to muscle and bone, and even organs and neurons, often without invasive procedures. And this isn't a far distant future. We're already seeing athletes use cell therapies for injury recovery, doctors using them for disease intervention, and even red carpet celebrities leveraging cells in their skincare routines. But these treatments are only as powerful as the cells that are used. So how can we access our best cells? Introducing Acorn, the world's first non-invasive follicle-based cell preservation solution.
Good evening, everyone. Welcome to our live virtual event, Stem Cells for Skin, Hair, and Future Health. We are so excited to have you here tonight to talk about some truly next-level regenerative technology.
Hi, everyone. I'm Dr. Yuly Gorodisky.
Hi, and I'm Lace Granatelli, the PA here at West Coast Plastic Surgery Center.
Tonight, we're going to break down everything you need to know about the secretomes and stem cells, what they are, how they work, and how we can use your own cells to enhance the anti-aging treatments and boost your overall skin health.
Now, here's something important. We have a very special offer tonight, but we're only revealing how to access it at the end of the presentation. So if you want to know exactly how to claim it, make sure that you stay with us till the very end.
We'll also be doing a live Q&A, so you can send your questions through the questions tab, and we'll answer them live during tonight's event.
Okay, so here's a little hint. The offer includes complimentary harvesting of your stem cells when you purchase 12 vials of secretomes for $19.99, which is about $1,500 in total savings. But remember, the steps to claim this special price will be shared only at the end, and you must attend live. Schedule your appointment within 4 weeks of tonight's event.
Acorn Biolabs is a regenerative medicine company doing something truly innovative. They're focused on using your own living cells, not just for cosmetic benefits today, but for real medical applications in the future. Right now, you can already use these stem cells to rejuvenate the skin and hair. But what makes this exciting is that there's a long-term vision. By preserving your young, healthy cells now, you're setting yourself up to access advanced regenerative treatments as science continues to evolve. This isn't a futuristic concept anymore. It's happening now. One of the smartest investments you can make in your future self is banking your own stem cells. As we age, our cells age with us. But if we preserve them today, we can use those younger cells later for treatments that help to restore, repair, starting with the skin and hair rejuvenation and eventually supporting broader health applications. Think of it saving your best version of yourself, a biological backup of your cells at their prime. So, when more regenerative options become available, your healthy cells are already stored and ready to be used.
This is where the future of medicine really comes into play. We can harvest your stem cells, and the best time is now, while they're at their healthiest. Then bank them for the future. Once your cells are stored, they're yours for life, and they're ready whenever you need them. As a new regenerative therapies emerge, whether it's for skin, hair, or a broader medical application, your healthy cells are already on reserve, giving you truly a personalized regenerative advantage. Currently at West Coast, we are using individuals' bank stem cells for skin and hair rejuvenation. Let's discuss skin regeneration and longevity. Secretomes work by helping restore your skin's natural renewal function. Over time, you'll notice smoother texture, more even tone, fewer visible wrinkles, refined pores, and an overall healthier glow. Now, this isn't about masking aging. It's about stimulating real cellular regeneration beneath the surface. Now let's talk about hair loss prevention and regeneration. For hair, secretomes can help support the hair follicle health. It can help prevent the thinning of hair and stimulate new regrowth. It's all about the proactive approach, not just waiting until the hair is gone, but preserving and strengthening what you already have. We've seen the best results are with patients who are proactive. Now, this is the key difference between a temporary solution and true regenerative therapies. When your live stem cells are activated, they produce and they release something called a secretome, a natural full-spectrum collection of over 500 bioactive molecules. This includes growth factors, your own exosomes, peptides, structural proteins, and cytokines, and they're all working together in perfect balance to support healing and regeneration at the cellular level. Now, we can use your secretomes for a regenerative function. Think of it like using your best cells to send a powerful repair signal to your skin and hair, a direct boost from your younger biology.
When we treat hair loss or thinning, we often combine secretomes with microneedling. The microneedling creates microchannels in the scalp, and that's where the secretomes can penetrate deeply, stimulating follicles, improving circulation, and encouraging stronger, healthier growth. Many patients are already familiar with PRP. PRP is a good treatment, but secretomes derived from your live stem cells can be up to 30 times more potent in their regenerative power. That's why results can be stronger and more predictable. For the skin, secretomes are a powerful healing and regeneration booster when paired with procedures like laser, microneedling, or other rejuvenation modalities. Normally, after these treatments, your skin needs some time to recover. There's redness, swelling, and irritation, which is all part of the process. When we apply secretomes, they accelerate healing, they calm inflammation, and stimulate deep repair through collagen and elastin production. Patients notice the difference: faster recovery, less irritation, and earlier and healthier glow. We can also layer secretomes into many other aesthetic procedures, like radiofrequency skin tightening, resurfacing lasers, and even after injectables. Because these molecules come from your own body, your own biology, your body will recognize and respond to them immediately. This allows us to optimize the outcomes and extend the longevity of the results, working from the inside out, not just from the surface. Thank you so much for joining us tonight for Stem Cells for Skin, Hair, and Future Health. It's been great sharing this new chapter in regenerative medicine with you.
And as promised, here's how you can access our exclusive event-only special. You'll receive a complimentary harvesting and banking of your stem cells when you purchase a 1-year supply of secretomes, which is 12 vials. This is for $19.99. Now, normally this would cost $3,500. So tonight's offer, you're going to save $1,500.
This special offer is only available for those who attended this live and remain valid for you to schedule your harvesting appointment within 4 weeks of today's event.
And in just a moment, you'll be receiving a text message from our team. Simply reply to that text message if you are interested to book a consultation or an appointment. And then our staff will personally reach out to you to finalize everything.
And don't go anywhere just yet. Lace and I are staying online to answer your questions live. You'll see a chat box on your screen, so feel free to type in anything you'd like to ask.
We can't wait to connect with you and help take you to the next step in your regenerative journey.
Hey, everybody.
Hello, everybody. We
All
are just
right.
waiting for Dr. Gorodisky.
I'm right
I'm
here.
here in our office in California, and we actually have Dr. G here from Florida.
Yes, I'm here online. I'm at my Florida office this week, and it's a little bit later here, but I'm happy to be here, and happy we're able to do this today.
Let's get started, Dr. G. I'll let you start.
Yeah, of course. It was a nice presentation. We kind of talked about what secretomes are, the company that we work with, and who produces it. And I think it's just a really awesome kind of next level of medical treatments. You know how regenerative medicine and is really on the cutting edge nowadays, and it's they call it medicine 3.0. And I think we're kind of heading in that direction. I think longevity and wellness, and this is definitely part of it, and really affects everybody. I think the way we apply it now with our cosmetic and aesthetic treatments is great, but it's really more about the future and what the potential of this treatment is. And we'll kind of go over that a little bit and answer all your questions. So feel free to write the questions in the chat box there, and we'll go over them. Mm-hmm. So Lace, how are you doing? So have you? I know you just collected one today, and we've been kind of working on here and there. I think it's definitely a lot more patients are interested in it. We have a couple of brochures in the office, but it's relatively new. But it's we've been doing PRP for a long time. And I've been doing also stem cells from fat, which I obtained during surgery. But this is a little bit different. Why don't we kind of went over a little bit, but why don't you kind of give us a summary?
Yeah. So let's take a step back and talk about things that everyone knows about, or maybe a little bit more than they know secretome. So PRP, platelet-rich plasma. So when we're talking about that, we're referring to, you come to the office, we take a vial of blood, we spin it down, and we remove the red blood cells, the white blood cells, and we're left with, sometimes we like to call it liquid gold. It's excellent. However, when you compare it to something like a secretome, PRP is nowhere as good. And let's talk about why. So PRP is very subjective, and it correlates with how are you doing today? Have you been sick? Have you taken medication? Did you drink alcohol? So there's a lot of factors, right? And I tell my patients when we do PRP, I want you to give me some good stuff. But I'll comment when we're talking about secretomes, we're not worried about that. I'm not worried about, did you recently have an antibiotic, right? Were you treated for something more recently? Because we're using your stem cells, and then when we send them to the lab, they're corrected for little errors like that. Also corrected for age. And so I really want to talk about age tonight with you, Dr. Gorodisky. I'm sure that there are patients who are perhaps over 50 on this call, which to me, 50 is young. And I know Dr. G would agree, but someone who's maybe feeling older than they were. Very important. This is appropriate for all ages. And we like to comment the best time is now, of course, right? Because we're only aging. But it's important that everyone recognizes that this is corrected for age. And don't worry if you feel like you're a little too old. You are not.
You're never going to be as young as you are today. That's the key. So yeah, I mean, we have a lot of questions in the chat here about the appropriate age to do it. Mm-hmm. Or if anybody's too old. So there's no such thing as too old, because the point is, if you're talking about just doing stem cells directly, or if you're doing PRP, then yes, age matters, because obviously as you get a little older, your PRP is not going to be as good quality. You're not going to have as many growth factors. Your stem cells are not going to be as active. However, because you're harvesting it and you're sending it to the lab will actually concentrate the cells that you do have. And even though they may not be great, but they will pick out the best ones, and they will make them produce the product that they need to produce to the same standard as anybody who is a lot younger. So that's the beauty of this treatment, that there's no such thing as being too old. Of course, it might take a little bit more work on the scientist's part to get them to do what they need to do, but they still can get it done no matter what age. So, if you're in your 50s, if you're in your 30s, if you're in your 70s, at the end, you'll get the same type of product that you can use for your rejuvenation. So that's a great question for that. Next question was, how many times a year do you have to do it for scalp? So actually, there was another question. Somebody commented that I should do it on my scalp. So it's funny because I've actually done it twice on my scalp. I'm kind of just like doing it just for fun, because it's kind of a little bit beyond. Usually you want to enhance. Obviously, it's not going to create new hair, but it's going to enhance and prevent hair loss. But with the treatment that we're doing, we are usually so when you do a harvesting and you get 12 vials of secretomes, we usually have patients come in every month or every other month, and we'll do anywhere between 2 and 4 vials on the scalp, depending on how much hair loss they have and how. So obviously, the more you do, the more area you can cover and the more concentrated you can make it. So usually we will do maybe 3 treatments every other month or so. And then you combine it with some topical treatments, with some supplementations, and things like that. So that's for hair loss protocol. That's what we do. We don't do surgical hair transplant, but for the non-surgical, this is our new treatment.
I've seen good results when we inject into patients that have hair.
Yeah.
I think it's important that we inject it. I like to think of this as like a beautiful fertilizer. And so we're injecting it where those hair follicles are. If someone comes to me and they don't currently have those hair follicles, we don't always see the best results. But that's because we're trying to help grow and nourish and heal what is currently there.
Right.
Another thing I wanted to talk about besides the PRP is exosomes. So exosomes are a very popular add-on in aesthetics. And those are going to be from a donor. So that's one thing compared to the secretome. Another thing, secretomes, think of it as this kind of umbrella where we have our stem cell. Within the secretome, we have, as we mentioned in the video, there's 500 aspects to this. And there is one part is the exosome. So you are getting your own exosomes. And I want to emphasize your own. We don't have to worry about, is there any RNA? Is there any external factors coming through? We know this is yours and it's good quality. Back to what Dr. G said about how we send your hair follicle samples to the lab, and those brilliant Acorn PhD scientists, they're going through and they're looking at, we want to get the best follicles, and then those are the ones that they're going to create into your secretomes. So there's a lot of different purifying standards that get us the best product. What do you have to say about exosomes, Dr. G?
I think exosomes are very popular, but there's very little science about them because if you go to so many places, they have exosomes, and it's always from somewhere else. Some places use plant exosomes, some places use baby exosomes, some places use donor exosomes, human exosomes, animal, bovine exosomes. So they're all over the place, and the point of the exosome is that it is a signal molecule. It's your nucleus produces a signal that it wants to break off from the cell and send out to another cell. That's how it works. And then that little particle that carries that piece of information gets released from the cell to go to another cell. That's the exosome. Exosome is basically like a messenger. Within the exosome is the DNA or the protein that's going to be carried to another cell. Now, if you harvest that, what's in that exosome? What we want in that exosome is what's the outside. That's what does the healing. But what's inside, nobody really knows, because it could be any sort of information. It could be, DNA about disease. It could be DNA about, inflammation. It could be just random strands of DNA which have nothing to do with anything. But the point is, we don't know. Nobody really knows what's inside the exosome. Now, if you're using your own, doesn't really matter. It's still your own. So you can be completely comfortable, and if it goes on you, if it goes in you, it doesn't really matter because it came from you. So you're not risking anything at all. So that's a perfectly safe treatment. So it's not yet FDA approved for injection, but it's approved for use topically, and we use it topically and microneedling. However, in some patients, I feel very safe injecting it because it's like we're taking your blood and we're putting it back. We're taking your PRP and we're putting it back. It's the same kind of a thing. It's not anything foreign or anything that really didn't come from you. So it's perfectly safe.
I've been injecting patients' scalp and I haven't had any negative feedback. I mean, I think anytime you have an injection, there's always a risk for maybe pain at the injection site, but I haven't had any issues. No one said it's burned or anything negative whatsoever. Want to make a comment. PRP compared to the secretomes are going to be 34 at least times more concentrated and better. Love quantifying it. And then if someone on here had asked, what's the secret with secretomes? Like, where did we get that word? Well, it comes from secretory cell. So when our body it recognizes that something is going on. Let's say we have an injury, for example, right? Microneedling, that's a controlled injury. Our secretomes are going to say, all right, guys, to our immune response, we need to heal it. And so that's where it comes from. It's a secretory cell.
It's the secret. The stem cells are secreting, basically. And that's why there's no secret to it. It's just secretion of the growth factors, the proteins, the exosomes, all of those things that, everybody likes. We love growth factors, which is what PRP is for. We also allow, PDGF. It's very popular nowadays. Some people are injecting it, some people are putting it topically. It's a great thing. But guess what? Secretomes have PDGF in it. Salmon sperm, same thing. It's the nucleotides in the salmon sperm, which people use for topical injection. I don't know about that, but your secretomes have that same product in it that you get from salmon sperm. It comes directly from you. So, everything that you could possibly think of that people put on their face from wherever, it all can be done just by harvesting your stem cell and producing it from your own tissue. So it's just a complete, it's even like, it's a no-brainer. You just, if you're thinking of doing something for your skin and there's all these options, this one thing covers all of them. Now, another thing is, and we didn't really mention it, but as we do these procedures, of course, we talked about microneedling and lasering and things like that. There are studies that show that putting secretomes topically speeds up treatment compared to just your standard care. So, even if you're not ready for anything drastic, if you are doing any kind of treatments, and you were to collect some of your secretomes, you'll have a little. So we get the vials ordered for you. It takes about 2 months after we harvest, and then we'll have it in the fridge. It has your name on it. So, and then when you're coming in for your treatments, if you're coming in for laser, if you're coming in for, just rejuvenating treatments, microneedling, hair treatments, the secretomes are there. We just pull the vial out. We reconstitute it with sterile saline or hyaluronic, and we put it either topically or injection. It's always there. You don't need to do another harvesting. You don't need to do another, wait another time. It's always there for you. And the 12 vials should last you for about a year. And then if you need more, guess what? You don't need another harvesting because it's there in the freezer. So you just have to, when you're close to running out, maybe a month or two before, we'll call them up and say, hey, we're ready for the next batch. And then they'll send a new one. And you just keep going and keep doing what you're doing. It's very convenient.
Circling back on what Dr. G said about healing, I mean, this is, to me, there's kind of two ways to think about it for me in the aesthetic realm. One of it is, okay, I want to just use my secretomes. I just want to just use the hyaluronic acid version of it, and I want to apply it topically. And I think that's a beautiful consideration if you want to kind of just dip your toe in the water, or you can consider it as an add-on for healing. So when we talk about healing, I'm actually able to give you a little bit more of quantification. So I'm talking about redness. In the study, they quantified tenderness, pain, discoloration, and swelling, as well as crusting. So if you've ever had a laser that broke the skin or even microneedling, you know that the next day you look a little sunburned, you may feel very dry. And so what we saw in the studies, what I've seen in my practice, is that patients are healing quicker and their journey's a little bit more comfortable because they don't go through that irritated dry phase.
Yeah, somebody just asked about skin pores. Pores are a big problem. And, we have a great laser for that. We have the Moxie laser. It does a wonderful job on pores. And then when you put the secretomes on top, it just makes it so much better. And the healing is so much faster.
Did it yesterday. Moxie with secretomes.
Yes. Now, somebody also asked, what about under eyes? So Can it be used for under eye? Now, there's two things about under eyes. Number one is dark circles. There's also skin thinning, and also there's fullness or bags. So they're different things. We approach them differently. Now, if you're just talking about dark circles, it's usually because the skin is kind of thinned out and you can see the darkness and the blood vessels and everything underneath. Secretomes would do great, maybe combined with a little light laser to help to stimulate the skin, make it a little bit firmer. That helps with the dark circles and the thinning. However, if there's fullness, if there's puffiness under the eyes, there could be something else going on. It could be that there's just bulging of the fat inside the eye. So sometimes you might need to consider surgery to actually shrink that fat or move that fat. Sometimes you can do a little filler, but it's not. Filler can be a little tricky under the eyes because it can swell and it can migrate. So there's different options, and so you're always welcome to come and do a consultation. We can figure out what's the best treatment.
Someone asked, can this replace fillers? I think it can compete if we want to talk about a very thin filler, maybe something like Skin Vive, which is an injectable hyaluronic acid where we're bringing water to the tissue and trying to increase hydration. Although if you're thinking of a filler to fill or plump, I don't think that they are, you can't compare the two. What's your answer to that, Dr. G? Would this replace fillers? They're different.
Yeah, it's different because fillers are basically to fill, to give volume. I mean, Skin Vive is more of just a basically hydrating treatment. It's really not. I mean, it's a filler, but it's really not
exactly
a filler. I think using secretomes can help. If there's volume that's needed, we could consider doing something like Easy Gel, which takes PRP and we kind of make it into a gel, and that also helps to give it a little bit more volume there. And there's also potential for fat. We can take nano fat, which is also a regenerative type of treatment because we take fat, but we're not injecting fat. We're breaking it up into just basically like thin liquid and putting it in, again, stem cells in the fat, just like in the hair, can help to stimulate and grow and thicken the tissues and the skin, and rejuvenation kind of a treatment. Now, as a reminder, you'll be receiving a text message. Please reply with the code word WEST, W-E-S-T, if you want to be contacted for a consultation after this. So, if there's any other questions that you may have, or if you want to be evaluated to see, if you would benefit from any type of treatments that we do, feel free to schedule a consultation. In any case, I think, harvesting your stem cells is the best thing you could probably do for your future self, especially if you're healthy, but even if you're not, of course, you have to make sure you stay on top of things and lead a healthy lifestyle and eat well and drink water and use sunscreen, all those things. But, unfortunately, time goes in one direction and, we're not getting any younger. So, if you save your stem cells today, in the future, you would probably thank yourself that you did.
And then the company that we're referring to, again, is Acorn. Now, we're specifically talking about mostly for our practice, the aesthetic portion of it, but Acorn also has a more medical and regenerative aspect to their company where they're looking for future applications. They've talked about how they've been able to regenerate cells, whether that be a neuron, I think they're working on a pancreas, different organs. And so that is something to keep in mind. I think now we can kind of consider, for the most part, we're doing fun things. It's going to help us heal and feel like our aesthetic best self. But there is a medical aspect to this that we want you to keep in mind, because you can choose to bank your stem cells today, your secretomes, but not necessarily give us the product. You can keep them in their cryotherapy chamber. Someone had asked, is it something about it like freezing your stem cells? They're a bank. That's a third party separate from us. And we're just calling upon them when you're ready for your product. So I want to make sure that we reference that as well. Also, Dr. G had mentioned the stem cells that come from fat. But that's because he's a surgeon. You guys know I'm not working in the OR. And so what are the places that we can get stem cells? We have our hair follicles, we have bone marrow, fat, and then when we were a baby, from our umbilical cord. And so what's really special about this is that we're able to get our stem cells from our hair. there's no bleeding, there's no numbing or downtime. And it's definitely a pretty easy procedure. It sounds kind of rough because I'm pulling your hair, but like I mentioned earlier, I just did it a few hours ago, and it is easy peasy. And if you're thinning, if your hair is thinning, I don't want you to worry that I'm going to be taking hundreds of hair. It's not like that at all. It's pretty simple, and we make sure to take it from different parts of your head.
Yeah, and somebody was asking, can you use this treatment to help healing after a facelift? So we can harvest your hair follicles either before or during your facelift. I think it will be helpful if we have the secretomes, and we're at the end of the facelift. Sometimes I'll do a laser resurfacing, and then that's where I would probably use them. I don't think I would necessarily use them under the skin when I'm doing a facelift, because that area, it has its own kind of healing properties, and we don't really want to add anything extra to it. But if we are doing, if you're considering a facelift, I think you're kind of on that journey of rejuvenation anyway. I think it's a smart idea to get those stem cells saved, and then, because once you're healed from the facelift, you'll still need to take care of your skin. You'll still need to kind of, work your way into that youthful youthful appearance. So I think using those stem cells in the future will still be a good idea.
Ooh, someone asked about another part of the hair, which is thinning eyebrows or beard hair. We absolutely can, off-label, we can inject it, or we could microneedle over it. That's a really great question. I mean, I love a full brow, and I'm sure a lot of women on here, we suffered through the 90s with the thin brow, so now we're trying to regenerate. So excellent question. We absolutely can use it on the beard hair and the eyebrows. Is it safe to use on sensitive skin or rosacea? Absolutely. I think this is a healing tool. So I actually think that if a patient who had rosacea, when I think of rosacea, I think of inflammation, were to have a procedure and then have secretomes, I would assume that they're going to heal quicker. And that's what I've seen in my practice, is that person is going to heal quicker, as all of our patients are seeing less redness and a quicker healing downtime.
Yeah, I agree. I think, it just helps with so many things. And especially right now, its main application is to stimulate healing, to regenerate, rejuvenate. And it's just, the future of it is really, exciting. So, somebody was asking, can you use it for healing joints? So again, it's kind of like in the future. Now, I just want to say that yes, you can use it, and I've tried it, and I've had good response. Is it indicated for it? No, or not yet. But again, it's your own material, so you're not putting anything foreign in it. You're not injecting there's no medication in it. There's no irritants to it. So, I've used it on a knee joint, and the patient felt better, and that's all I have to say about that. So I think there's definitely a lot of exciting applications to it, which are not necessarily mainstream right now, but definitely are looking favorable.
And then we covered how age is not something that should be concerning of someone. Also want to mention, whether you have thin or thick hair, it's not an issue if you've colored it. The only comment that I would say is, if you're someone who uses a lot of leave-in products and you don't wash your hair every week, which some people like to ride it out, maybe I would consider coming in with clean hair. But besides that, it's absolutely not an issue. I think the majority of the population does have treated hair, and we are collecting those hair follicles.
And somebody was asking, how long can you keep them frozen? It's forever. I mean, as long as you're alive. I mean, they're frozen in the chamber, and they basically just keep them there forever. And when you're 90 or 100, if you're still alive, and if you want to call them up and say, I want some cells, there you go. You'll have if you get them done when you're 40, you'll have your 40-year-old cells when you're 90.
And they're yours. Exactly. Just so you know, when I learned about this company, I asked, I want to make sure there's no funny business. You own these cells.
They don't sell them. They don't experiment on them. Correct. They don't clone you, so don't have to worry about that.
You own them. Yeah. If you've ever done PRP, or you're someone who's
interested in PRP or kind of continuing that, I would heavily have you consider using secretomes. When you look at the price differentiation, you might as well invest in yourself now. You can always use your product now, get those 12 vials to use within the year, and then wait. So although I feel like at first it sounds like this huge commitment to bank your cells, really there's two parts to it. You're banking it, okay, and there's a small annual fee, and then you're also purchasing your secretomes. But once you get those secretomes, or you could just decide to bank them. So I want everyone to make sure that they're looking at this in like the long haul of your rejuvenation. And Dr. G said, what if you get this done when you're 40? Where are you going to be at when you're 90? Well, all of us are going to hope and root for Acorn to continue their studies so that we can continue having rejuvenation of not just the outside aesthetically, but more so internally.
Yeah, maybe by then they'll be able to give you a new liver and a new pancreas and what else you might need at that point.
Absolutely.
And somebody's asking how many times do you have to do it? You only do it once. If the stem cells are adequate, sometimes if somebody, their hair is very thin, even though you collect enough hair, but the quality is not that good, you might need to do a little top up. But usually once you get a good quality sample, you don't need to do it again. So, unlike with PRP, you have to draw it every time you come in, you have to spin it, you have to inject it. And then like Lace was saying, it depends on your day. If you're not at your optimal health at that day, your PRP may not be as good quality. Here, you're assured that every time you come in, you have the same quality product that you can use, and you don't have to worry about it. There's no additional harvesting or no additional kind of hoops to jump through. It's always there. You sit down, we take it out of the fridge, and there you go. It's yours. It's ready to go.
Such great questions, Dr. G.
Yes. All right. Well, I think, if anybody has any more questions, feel free to reach out and email. I think we kind of covered most of the basics here. It's very exciting. I think there's going to be a lot more. We'll probably be posting a lot more information on our social media pages and maybe do some more events, but, very excited to offer this to our patients. And, make sure if you wanted to schedule a consultation, do it. You can even consider it as maybe consider it as a gift to your friends and family, because listen, if you have kids who are younger and, just like when your kids are born and you save their cord blood for the future, you never know. Same thing, if you miss that chance, this is your other chance. You can actually save their stem cells now when they're young, and then they don't have to touch it until they're older in case they need it.
Acorn has family plans.
Yes, that's true.
And then I wanted to just remind everyone, Dr. G, our amazing deal for tonight, which is for our live participants. We are offering a complimentary retrieval. That alone is $1,000. So complimentary retrieval if you pay for 1 year. So your 12 vials, and it comes out to be $19.99, which overall is a $1,500 savings. So we want to thank everyone who attended live, sent us their amazing questions, and we cannot wait to see you in the next month. Of course, we're always here, but we're offering this spectacular deal for those patients that come into our office within the next 4 weeks.
Yeah, I'm thinking we're probably going to stop doing PRP in the future. We do have a promotion with the PRP because obviously when you first time you come in, for harvesting, you're not going to have any secretomes. So we are offering a PRP treatment for that first day. But, going forward, why would you want to do something inferior? You definitely want to do something that's much better. So, definitely moving away from that and towards new and better things.
I absolutely agree. And I'm seeing great results. We're already seeing great results. We know the research is good, but we're seeing it excellent here with our patients at West Coast.
Yeah. All right, everybody. Well, thank you very much for attending, and we'll be seeing you around.
Bye. Good evening.